For the pain, he gave you a cream. Yeah, that's not how you treat sciatica. No. Hi everyone, if you've been diagnosed with sciatica or a disc herniation, you have pain shooting down your leg, don't go to a medical doctor. A medical doctor will probably prescribe you, what did he prescribe you?
I don't know, a cream.
A cream. A cream to put on her leg.
Yeah.
I don't know.
No, the cream for the legs is something else. I'm talking about for the pain.
For the pain, he gave you a cream. Yeah, that's not how you treat sciatica. So she had painkillers prescribed. She had cream prescribed. These are not the treatments for sciatica. Sciatica is often, it's a pinched nerve, but it's usually because of a disc injury. So how is a cream or pain medication going to fix that? It could make her an addict, though, right? So I thought we were past that. I thought we were past prescribing pain medication for these things. So this, again, this is 2021, and this is what's happening here. So now she's on her third treatment, and your leg pain is it better?
Yeah.
3 treatments. And how does it feel?
I feel good.
She feels good. Now, did cream do that? Pain medication? I mean, enough of these prescribing pain medications. These doctors need to stop. They really need to stop. And they need to start referring to chiropractors more often. So we're going to send her doctor a little nice letter, just updating her on her situation and how she's feeling. So let's take a look. We're going to do cox flexion distraction on Minerva here. And I'm going to slide you down a little bit. Yep.
Yeah.
Okay. Okay. So she gets sciatica down the left side. And we're just going to do some gentle cox flexion distraction technique. And this is the gold standard for sciatica. So many people just don't know about it. And that's why I'm doing this video with her. And thankfully for you folks, Minerva was nice enough to let us show everyone how it's being done. So what we do is we gave her some heat in the beginning, and in some of these cases we even put people on spinal decompression. She's doing so well that we don't need to do that for her today, but the flexion distraction is more than enough. And also in the beginning, when somebody's dealing with sciatica, you don't want to do too much. You don't want to put them on decompression and then do flexion distraction. And too much sometimes makes a patient a little worse in the beginning. So you want to ease your way into these cases and get an MRI if possible. And in some cases we don't have an MRI, we just have x-rays. We have digital x-ray in the back that we can use. And okay, how are we doing here? Any pain down into your leg?
No.
Feels pretty good, doesn't it?
Good.
Yeah. People describe it as feeling like a good stretch, a stretch they've needed. It looks so simple and such a small movement, but with the right hand placement, it's extremely effective. We've already taken her through the proper protocols the first 2 sessions. So she's saying she feels better, and that was after 2 sessions actually. So I'd like to correct myself. 2 sessions. So today's our third. She's going to do even better now, but she still has some work to do. We're going to go over some stretches for her in case it does flare up again. Because sciatica has a propensity to flare up because it's usually coming from a disc injury. And disc injuries, some can be permanent, meaning a disc herniation is permanent, a disc bulge is not considered a permanent injury. So, they have a propensity to return, especially if, for example, a couple days ago you lifted a heavy air conditioner or something, and you might not feel it till a few days later or even a week or 2 later when you go to sit down for a couple hours or take a long bus ride or train ride or car ride, okay? So it's something that has to be taken care of over time. And one of those ways is to stretch, to exercise, to strengthen the glutes, the core, and finally, and not least, is to do some maintenance chiropractic care. Depending on the level of degeneration in your spine and your age, really depends on how frequent. We have some people in degenerative stage of 2 or 3, and they require a little more frequency. So maybe once a month, some of them once every 2 months, and then we have other people younger that don't have as much spinal degeneration. And oftentimes they can get by with maintenance care for 4 to 6 visits a year maybe for maintenance care, barring any injuries or exacerbations or any problems like that. How we doing here?
Okay.
All right, we're going to do a little drop here. So this is a Cox 8 table, and Dr. Cox incorporated a drop piece, Thompson technique. Now, some people would put her on her side and adjust her that way. I wouldn't do that with sciatica. It can be done and it's fine, but Cox technique is much better for sciatica. And take a deep breath in and blow all the way out. Now, what I'm going to have you do is keep your legs straight, and you're going to raise one leg at a time. Go ahead. Go ahead, raise one leg up, keep it straight. You want to raise your leg up for me, Minerva?
This one, the same one?
Either one. Yeah, one leg at a time. Keep your legs straight. Raise the whole leg up off the table. No. You're just going to go like this. Watch. You're going to keep your legs straight, and you're just going to raise it up.
Okay.
Okay, go ahead.
So I do the other one too?
No.
No?
Start with this one. You're going to keep your legs straight and going to raise the whole leg off the table as high as you can. Go. No, Minerva, I'd like you to keep your legs straight and then raise it up. It's okay. Go ahead. So raise the thigh off the table too.
Like that?
Watch. Watch me.
I don't
Watch me.
Sorry.
Like this.
Oh, like that.
One leg at a time. And then, yep. Okay, go ahead. There we go. Good. And down. And the other one? Okay.
Okay, now
And the other one? Okay, is one harder to raise than the
Oh
other?
my God, es un poquito.
Okay.
Es un poquito.
Okay.
Un poquito, nada.
All right. And relax your head down flat there, yeah. So, living in New York, all these years, I've had to deal with patients from all over the world, and it's before Google Translate, it was really hard. But we've had to pull out like Google Translate just to treat like patients from China or Russia that don't speak English. So we used to see a lot of people from the embassies, some of the embassies, and still do. And some of them do, and some of them don't speak English. So that's a challenge, and always a communication challenge when you're dealing with other languages. And you okay there?
Yeah.
Okay, if there's anything you don't understand that I'm saying, just let me know, okay? Okay, we're going to do that leg check again. Go ahead. One leg at a time. No, remember, we're going to raise the whole leg off the table. The thigh too. Okay, and down. And the other leg? Okay.
When I put them on it.
You could just relax there. Okay, take a deep breath in. Bend both knees. See. Take a deep breath in. And blow out. Good. Okay, turn over on your back. Boca arriba, por favor. Okay, hands up in the air. Straighten your legs out.
Straight.
Okay, relax your arms. I like your sloth shirt. You got a sloth there on your shirt. Relax your arms, relax.
Oh, the hands.
Yeah, relax.
Sorry.
Relax your head, neck. Yeah. Any headaches?
No.
¿Duele la cabeza?
No. No.
Good, bueno. Relájate.
Okay. Oh my God.
Okay, yeah. And relax here.
Yeah.
Hands up in the air again. Okay, come on up, stand up here. Face me. Come on over here. Okay. I like your sloth on your shirt. Those are my favorite animals. If you haven't seen my video, I have a video of me holding a three-toed sloth. You got to check that video. It's my favorite YouTube video. Anyway, I love those animals. Okay, look straight ahead at me. Straight ahead. There we go. Okay. All right.
Yeah.
You're all set. I'm glad you're feeling better. I'll see you next week.
Thank
Okay?
you.
You're welcome.
Okay.
Thanks for tuning in, everyone.
Okay. Have a nice weekend.
You too.